Okay, so we'll now continue on talking about the muscles in the pelvis. So I have a CAT scan pulled up. We'll switch over to the MRI. I think CAT scan is going to be a little bit easier to see, but MRI does show some things a little bit better. So we'll start here. This is the invasive adenocarcinoma. I use this for female pelvic anatomy as well, but we'll use this for the muscle groups as well. So start all the way at the top and start heading down. Okay, now we're looking at muscles in the pelvis. So let's start when the crest starts to come in, okay? So we have crest. First thing we want to identify are the psoas muscles, which should be very easy for you guys right now. Psoas muscles are always going to run lateral to the body of the lumbar spine, okay? So follow your psoas muscles. Once you get into the ilium here, you now have the iliacus muscle that's going to kind of cup right on the inside of the ala of the ilium, okay? So there's your iliacus. And remember, these two muscles are going to, as we travel down, combine, all right? So here they come together to form the iliopsoas muscle. So there's your iliopsoas now that they've combined, which is now going to come down and insert at the lesser troch. So follow it down, and here it comes in, and there's your insertion at the lesser troch. Okay, so we'll start back up. Back up, back up, back up. Psoas muscle. Here's your ala of your ilium. There's your iliacus muscle in here. They're going to combine to form the iliopsoas muscle here. Follow it down until it inserts at the lesser troch. Okay, let's go back up a little bit. Let's pick out our big gluteus muscles, which should be the easiest to see. The most posterior, largest one is your gluteus maximus, gluteus medius, gluteus minimus. Okay, in here, 1, 2, and 3, sandwiched right in there. As we travel down a little bit further, you're going to come into the piriformis right here, piriformis muscle. Okay, it attaches at sacrum and coccyx here. And then the next muscle that's going to come in is going to be your coccygeus, right here, attaching to the coccyx. You can see these muscle striations here. Now I want you to notice the difference between the coccygeus muscle, which kind of looks really thin. It's just like this little net down here, versus the gluteus maximus or the psoas muscles, okay? Or even here's obturator internus muscle right here. The big difference is that these muscles, they actually perform movement and structure and holding up of the body, and they adduct and abduct, and there's many different functions that these muscles provide, these thicker muscles, whereas these muscles, the coccygeus and the levator ani muscle, which is right here, see this little guy here, those are more support muscles, okay? So remember, those support muscles, they don't really need to, it's not like they're flexing and extending all the time. They're really just there for support. So it still is muscle tissue. You still can exercise these muscles, specifically by doing Kegel exercises, those of you that have heard of them. However, it's not the same as exercising or the need to have these bulky muscles in other areas. Okay, so we did the coccygeus, we've got the piriformis, we've got the coccygeus, here's the levator ani right here, levator ani. Obturator internus is this guy right here. He's going to loop around and attach at the greater troch. That's the internus over here, obturator internus right here, attaches from pubis to greater troch internally, okay, on the inside of the ischium. On the outside of the ischium from pubis to greater troch is the obturator externus, okay? And these two muscles, remember, combine to adduct and abduct the hip joint, okay? So those are those muscles. Pectineus is right here. All right, so those are the main ones that I would have you know, okay? We can review them really quickly. Psoas, iliacus, combining to form iliopsoas, coming down, inserting at the lesser troch, We have here gluteus maximus, gluteus medius, gluteus minimus. Let's get down into the piriformis right here, this bigger, bulkier, and then traveling down to the coccyx, coccygeus right here. We have levator ani right here, obturator internus right here, and right here, obturator externus right here. Okay?